Thank you, Mr. President. I rise to speak about children's health insurance, an issue that we hear about periodically, but not nearly enough, and an issue that will fast become a critically important question before both bodies, the Senate especially, because of what could happen to the Children's Health Insurance Program, which we call at the state level the CHIP program, CHIP, known more commonly here in Washington as S-CHIP, one of the great advancements in healthcare in recent American history. You could go back 25 or 50 years, and other than Medicare and Medicaid and maybe a few other examples, VA healthcare, children's health insurance has been a great success. And I would say forthrightly a bipartisan success, but we need to keep it that way. I have particular interest in this program because of the experience we have in Pennsylvania. Tens of thousands of families have benefited from the Children's Health Insurance Program that was signed into law. It just happened to be signed into law and advocated strongly by my father when he served as the governor of Pennsylvania. At the time, Pennsylvania was a model for the country. This is the early 90s I'm talking about. When he signed that bill into law, Pennsylvania became one of the leaders, one of the largest states with a new children's health insurance program, which then became a model for the nation. And here's how that happened. In 1997, Congress passed the bipartisan Children's Health Insurance Program, signed into law in August of 1997 by President Clinton. The original bill was co-sponsored by the late Senator Ted Kennedy from Massachusetts, of course, and the senator from Utah, still serving, Senator Orrin Hatch. They worked together, along with many others, in a bipartisan fashion to produce important legislation for our children. Since that time, this program has worked as a remarkable public-private partnership to deliver critical health care to children. So in addition to being bipartisan, it was public and private together. Care such as well child visits, immunizations, physical and occupational therapies, home health care, medical equipment, and more were all available for the first time for many, many families. So it helps children not only have health insurance and health coverage, but it helps them be well and to stay well over a long period of time, providing them the care that they need and giving their parents something that government doesn't do enough: peace of mind. It provides a measure of peace of mind to parents and to families. In 2009, the President signed into law a bipartisan reauthorization of the Children's Health Insurance Program. The most recent year of data indicates that CHIP covered over 8.1 million children over the course of a year. Just consider that. With this program, more than 8.1 million children have health care that would not have it any other way in the absence of this program. Even with the progress we've made in providing new health insurance options in the last couple of years as a result of the Affordable Care Act, the rate of uninsured Americans overall is still over 13%, the lowest rate since 2008, but still too high. The rate of uninsured children is 9%, a much lower rate, obviously, than the overall rate, but still too high. And CHIP has played an important role in increasing access to insurance for children. The website for the Pennsylvania program, which is www.chipcoverpakids.com, includes several stories from Pennsylvania families, parents, about how the Children's Health Insurance Program in the Commonwealth of Pennsylvania has helped one particular family, in this case, and many others as you read the stories. Here's one story, and I'll just sum it up briefly. Quote, "The CHIP program has been great," so said one family member. "We know that this is quality insurance, and we are finally able to sleep at night, knowing that our kids can be seen by excellent pediatricians. I do not know what we would have done without the Children's Health Insurance Program. Now my children can play sports and go away to camp like other kids, and if they get hurt, CHIP is there for them, unquote. So said a parent. Probably the best summation or the best recitation of all the reasons why it is so important to make sure that we preserve the Children's Health Insurance Program and preserve the funding for it and preserve any strategy that will ensure that children have the health care that they need. So CHIP is always going to be there for those kids. That's what we need to make sure that we hold on to. And I've, like so many here, and many in both parties, have consistently advocated for the Children's Health Insurance Program, and I'm pleased that it's been authorized through fiscal year 2019. However, and this is why I'm standing here today, however, we were able only to secure funding through 2015. So the program is reauthorized to 2019, but funded only through fiscal year 2015. And that deadline is approaching. Now is the time to act, again, in the right bipartisan way to preserve the Children's Health Insurance Program. It's time to make sure that we ensure that CHIP will continue to be funded through the authorization, at a minimum through fiscal year 2019. Senator Rockefeller, one of the great champions of this program over many, many years now, decades literally, introduced legislation last week that I wholeheartedly support, and that's an understatement. There's not a senator in this chamber that should not support his legislation. The CHIP Extension Act of 2014. It's Senate Bill 2461. The legislation extends funding for CHIP through fiscal year 2019, bridging the funding in line with the authorization. I cannot stress enough the need to pass this legislation this year, pass in 2014 legislation that deals with this 2015 problem. State budget cycles are such that if we wait until next year, when the funding is about to expire, we'll be jeopardizing health insurance for millions of American children. States need time to plan their budgets and cannot operate under the uncertainty of a funding cliff for such an important program. So I want to thank Senator Rockefeller for his tireless commitment to the Children's Health Insurance Program over many years, and I said even over several decades now. And I want to thank him for his work in introducing this legislation. So I urge all of my colleagues in both parties to support Senator Rockefeller's bill, the CHIP Extension Act of 2014, Senate Bill 2461, to make sure that the children's health insurance will always be there for the children who are covered by that program. And I think in conclusion, Mr. President, this is very simple. We have people in both parties who spend a lot of their careers saying how much they care about children. They give speeches, they campaign and talk about kids. We all talk about kids in very positive ways. That's wonderful. But the test is how you act and what actions you take, and that usually means how you vote. So if you vote for this bill, you can stand up and say that I've taken a substantial step in the direction of ensuring that children will have the health care that they need. If you don't, and you vote against it, I don't think you can say that. And if you vote against it, I think you have to have a substitute for it. Some measure that will provide the same coverage for the same number of children by a different method. And if you can't come up with that, you can't stand up and say you're for kids. You can't stand up and say that you care about our children and our future. So, Mr. President, with that, I would yield the floor and note the absence of a quorum.